bloating, pelvic pain, feeling full too fast. These might seem like everyday issues, but they could be warning signs of ovarian cancer. The scary part? Many women ignore them until it's too late. Today, I'm breaking down the symptoms you should never brush off, plus what to do next. Let's get into it. Hey everyone, today we're talking about something super important: ovarian cancer. Now, I know cancer isn't exactly a fun topic, but here's why this matters. Ovarian cancer is often called the silent killer because its symptoms are sneaky. They're easy to brush off as just bloating, stress, or that time of the month, but catching it early can be life-saving. So I'm sharing the top red flags you should never ignore, plus when to see a doctor. Let's dive in. First, what even is ovarian cancer? It's when abnormal cells grow in the ovaries, the organs that produce eggs and hormones. Unlike some cancers, there's no routine screening test for it, which is why knowing the symptoms is so crucial. And while it can happen at any age, women over 50 are at higher risk, especially if you have a family history of ovarian or breast cancer. But here's the thing, no matter your age, you should still pay attention to your body. Okay, let's get into the symptoms. And remember, these aren't just one-off things. We're talking about symptoms that stick around for weeks and keep getting worse. 1. Persistent bloating. We all bloat sometimes, right? But if your stomach stays swollen for weeks, like you can't button your jeans even when you're not on your period, that's a red flag. 2. Pelvic or abdominal pain. Not just normal cramps. I'm talking about a constant nagging pain in your lower belly or pelvis that doesn't go away. 3. Feeling full too fast. Imagine eating just a few bites of a meal and suddenly feeling stuffed. If this happens often, it could be a sign. 4th, urinary changes. If you're suddenly running to the bathroom way more than usual, but you don't have a UTI, your ovaries might be pressing on your bladder. 5. Unexplained weight changes. Losing weight without trying, or gaining weight just around your belly. Both can be warning signs. 6. Extreme fatigue. Not just, I need coffee. Tired, I mean exhausted all the time, even after a full night's sleep. 7. Bowel troubles. New constipation, diarrhea, or just weird changes in your bathroom habits. Don't ignore it. Now, if you have one or two of these occasionally, it's probably not cancer. But if they're frequent, severe, or last more than 2 weeks, please see a doctor. Here's the problem. These symptoms feel so normal. Busy women blame stress, digestion, aging, you name it. And since there's no pap smear for ovarian cancer, it often gets diagnosed late. That's why being your own advocate is key. So when should you get checked? If you have these symptoms for more than 2 weeks, or if they're getting worse, book an appointment. Ask about a pelvic exam, ultrasound, or CA125 blood test. And if your doctor brushes you off, push back. Your health is worth it. While there's no sure way to prevent ovarian cancer, you can lower your risk. Know your family history. Consider genetic testing if cancer runs in your family, and maintain a healthy lifestyle. Every little bit helps. All right, let's recap. If you have persistent bloating, pelvic pain, or any of these symptoms for weeks, don't wait. Get checked. And hey, if this video helped you, share it with a friend or family member. You never know who might need to hear this. Drop a comment below if you've ever experienced these signs or have questions. And don't forget to subscribe for more health tips. Thanks for watching, and take care of yourself.